starts. Yeah. Okay, are you ready?
Yes, I am.
Yeah, I'm just that one double check that the recording is there. Let me just double check. Yes, it's working. Yeah, it's working. And then it double check. So, okay, so you can see the timer, yeah? So
Yes, I
you
can.
can calibrate yourself. Okay, so I will start the timer then. Yep, go ahead.
Hello, good evening. My name is Dr. Aya. Am I speaking with Jack Mark?
Yeah, doctor. Yeah, thank you for calling.
Yeah, can I confirm your 24 years?
Yeah, yeah, exactly, doctor.
Okay. How can I help you today, Jack?
Well, to be honest, doctor, I feel I become snappy, doctor.
Hmm. Okay. Do you want to talk me through what you mean by being snappy?
Yeah, so I feel I'm becoming more anxious, doctor.
Hmm.
like my temper becomes short. You know,
Hmm.
uh, I become, there's a couple of times that I become very angry with my on my partner for simple reasons, which I feel that I shouldn't behave like that.
Oh dear.
And also in the work, they start to, I start to get some complaint. So
Hmm.
I'm working in customer service, and then to be honest, I started to fight with the customer instead of solving the problem.
Oh dear.
So yeah, I'm not sure what to do.
Oh
Yeah,
dear. Hmm.
still
Hmm.
nothing physical to be honest, but I'm worried
Hmm.
that because I feel the amount of anger in me that it might become physical one day.
Okay. I'm sorry to hear all of this, Jack. It's good you've booked this appointment. Hopefully, we'll be able to sort things out for you. Is that okay?
Yeah, sure, doctor.
So you said this has been going on. How long has it been going on for?
Well, being snappy, it has been now for some, around the year, but the last
1 year.
few months, yeah, but the last few months become more,
Okay,
and
it was.
becoming more obvious,
Mm, mm, mm.
and really, I'm worried that I might become physical against
Okay.
even against my
Mm,
partner, especially.
mm, okay. And have you had any thoughts about what could be making you snappy, angry, and all of that?
Um, no, I'm not sure to be honest.
Nothing comes to your mind
I'm
at all.
little bit. Um,
Mm,
I'm little bit
okay.
maybe anxious. I'm preparing for an important, context for, for preparation of Mr. Olympia. So it might be that. I'm not sure.
Okay. And when is this contest coming up?
It's come. It's around a year,
1 year.
doctor.
1 year.
Yeah, 1 year.
Okay.
Yeah,
Okay. And you mentioned about being worried about getting physical, and that's why
yeah.
you've booked this appointment. Is there another thing you're worried about, Jack?
No, no. To be
No.
honest, no.
Okay. We'll certainly see how we can help you out today. Was there anything on top of your mind you were thinking we could do to help?
Well, to be honest, maybe blood test, doctor, or something. I'm not sure.
Okay. We'll surely look into that. But was there any blood test in particular you were thinking?
No, no, no. To be honest.
Okay. I would just want to ask some questions just to check that we're not missing anything. Is that okay?
Yeah, sure, doctor.
So aside from feeling anxious, hungry, have you noticed your heart racing more than normal?
Well, sometimes I will feel my heart is fluttering a little bit, and
Mm.
I'm a little bit also sweaty when I become anxious.
Oh dear.
Uh,
Okay.
yeah.
Okay. Has there been any pain in your chest?
No, no, I didn't have any pain in my chest at all.
Any shortness of breath or difficulty with your breathing?
No, no.
Okay. And you mentioned about sweating. Is it just on your palms, or is there any specific part of the body that you have the sweating?
No, it's everywhere, to be honest, doctor.
Everywhere. Okay. And does this sweat occur at night time, or is there any specific time of
Yeah,
the
no, no,
day?
no. Even during, even during night. Yeah,
Mm,
yeah, yeah.
okay. And sometimes, I mean, lifestyle can have an effect on our health. By any chance, do you drink coffee?
Well, caffeine is part of my routine, either an
Mm,
energy drink or either coffee. I need it to keep lean, so I will not
mm.
gain any fat.
Oh dear. Okay. And how much do you drink of coffee or caffeinated drinks?
I never count, to be honest, doctor. Whenever I can, especially before going to the gym, I need to
Hmm.
to boost it up.
All right. Okay. And in terms of your lifestyle, do you drink alcohol?
No, no, I
Mm.
don't
Do
drink
you
alcohol.
smoke?
No, 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 never.
Do you take any form of recreational drugs, Jack?
What you mean by recreational drugs, doctor?
Maybe drugs that are got on the streets like cannabis, marijuana?
No, no, not of that
No.
kind of
Okay.
drugs, no.
And aside from feeling anxious, have you had any has there been any problems with your sleep?
Well, no, sleeping wise, maybe it's difficult to go to the sleep, but once I
Mm.
sleep, I sleep.
Okay,
Because
good.
I should have a good night's sleep to maintain my
Mm.
muscle bulk.
Mm.
I don't
Mm.
want to lose my muscle. The context is coming after a year, and then I need to build up the muscles.
Okay. And your appetite for food, is that good?
Yeah, doctor, I'm eating 6 meals a day.
Okay, good. And what would you say your mood is like?
My mood is fine. It's just snappy. Yeah, my
Okay.
mood is good. I am in the go, and I'm always, waiting to increase my muscle bulk.
Hmm.
So yeah, and I reach a good size now, doctor. So
Okay.
I'm happy, with what I reach. So my mood
Okay.
is okay. Yeah.
All right. Okay. And in terms of your weight, by any chance, do you know what you weigh, Jack?
Well, yeah, doctor, for sure. I'm weighing myself every day. So I'm now around 80 kilos.
All right. Okay. Good. And I can see from your notes you're not on any medications. Is that still the same?
Yeah, yeah. You
Okay.
mean, what you mean medication? Sorry, doctor.
Any medications that you take maybe over the counter?
Well, it's not over the counter. I'm taking some medication for bulking, doctor.
Okay. And what's the name of the medication?
Well, decadrenaline, doctor's injections.
All right. Okay. And how did you get that?
Well, my trainers bring it for me.
Okay. 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 I know you said to me that your mood has been okay, but has there been any times you've thought of harming yourself or ending your life?
No,
No.
no,
Okay.
doctor, no, no.
And at any point, have you noticed that you hear voices that others don't hear or see images others
No,
don't see?
no, doctor,
No.
no.
No. Okay. Anyone in the family who has got any form of mental health problems?
No, no.
Okay. I mean, based on everything we've discussed so far, I mean, you've said to me that you've been anxious, getting angry, and even at work. I mean, I would want us to like do further assessment for you. There's something we call the generalized anxiety disorder.
Okay.
There's a questionnaire which I would want you to complete. Is that something you'll be happy to do, Jack?
Yeah, sure, doctor, yeah.
Okay. Are you happy I send you this as a link on your phone so that you could complete it and then we could further assess you?
Yeah, no problem, doctor.
Okay, because I suspect we might be dealing with what we call generalized anxiety disorder.
Well, okay, but why I would have it, doctor?
I mean, based on the symptoms you said to me that you
Yeah,
get
I mean,
anxious, angry, and then you've had
uh,
sweaty palms and you feel your heart racing.
yeah, but I got you. But is something wrong with me, make me feeling like that, or just maybe because I'm worried about the context? I mean, what
Yes,
might be causing it?
that's another possibility. You could be anxious because of the contest you've got in a year's time. That could be another reason why you're a bit anxious at the moment.
Okay, okay.
I can
So,
see from your
mhm.
records as well that you've got license for gunshots. Is that still the same?
Yeah, yeah, doctor. Yeah, sometimes I'm going for shooting. Yeah,
Okay, but have you got a gun yourself?
yeah. I have a safe and
Okay.
with a gun, and the police is checking it every year.
And aside from you having the safe, is there any other person who is at home that got um, the key
Yes,
to the
no,
safe?
no, no. The case is usually with the owner only. No, it's only me.
Okay, because you mentioned to me that sometimes, I mean, in terms of your home situation, sorry, I didn't ask you, whom do you live with?
But my partner, I'm living with
Okay,
my
and has
partner.
your partner got license to where the key safe is as well?
No, she doesn't have access to the key. You mean the
All
key
right.
safe? No, no, I'm the only one who have access to it.
Okay, that's fine. Okay. Like I said, I would want to us to complete the questionnaire and then see how what next to do, if that's okay. But at this moment, do you think you would benefit from some help, like some talking therapy?
Yeah, I think that will be fine if that will make me less anxious. Yeah.
Yes, so I would send you a link for it's usually self-referral. So I would send you a link and then you can get to book an appointment to talk to somebody. Is that okay?
Yeah, sure, doctor. Yeah, yeah.
Okay. And
But would you like to do some blood tests for me?
yeah, sorry, I forgot to say that. So you mentioned about wanting some blood tests. Just, I mean, I would say, yeah, yes, we could arrange some bloods.
Okay.
Yes, we could arrange some bloods to check your blood count, to check your thyroid function. And and see if there's anything deficient. Is that okay
Okay.
with you?
Yeah. Well, yeah. That's fine. I mean, I'm happy
I
with
would
that.
also, yeah, I would also want to send you some leaflets to read more about anxiety, if that's okay with you.
Yeah.
What are your
Sure.
thoughts about that?
Yeah. Sure.
Yeah. And also I would want to see you in about 4 weeks' time, if that's okay with you. Hopefully the bloods will be back and then the questionnaires are ready as well.
Sure, doctor. Yeah.
Okay. Thank you for your time, Jack.
Yeah. Thank you. Thank you. Really. I'm very
Thank you.
happy to speak with you.
Thank
Thank you.
you.
Okay. So, Ayo, tell me, what's your reflection?
I don't know what this case is about, to be honest.
Mm. So, if you have a chance to repeat it, would you do something different?
Um, Maybe I would have asked a bit some more questions about, because when Jack asked for blood tests, probably I would have um wanted to ask questions relating to thyroid problems.
Well, that yeah, for sure. That one, yeah, sure. This is one of the things, but he give you some important cue there, couple of them, which is
Yeah,
all the cases is dependent on these simple cues. And
yeah.
that's why it's very important to listen to the patient and don't to dismiss it. And there is other couple of cues in the given information. So usually if there's any information given, you would need to use it in your management. Okay, so you have history that you have reduction mammoplasty in Turkey from 12 months ago. So means that he might be having gynecomastia most probably, and then he needed to go for operation for that. So what was the cause of the gynecomastia? And then he is 24, he have severe acne, and he take 2 courses of lemcycline.
Mm,
So is this something playing in his hormone, isn't it? Well,
mm,
gynecomastia, acne, this all are related to hormones. And then they put a gunshot in the middle. You did ask about the gunshot, but they didn't say what you would do with the gunshot, isn't it?
mm.
Yeah, and that's important. So,
Yeah, so
yeah, so if we take it step by step, so in the beginning you did your introduction very good, but then you say, well, how can I help you? Already he told you it's written there he's having an anxiety. So use that. Okay, I can see
mm,
that you have problem with your mood and you have problem with your anxiety. Is that what you are coming today for?
mm,
Then yes, okay, so then you can say, okay, can you elaborate more when all of that started? Take me from the beginning and how that is affecting you, and listen to him. And then he give you some cues, which was important. Yeah, he told you, "I'm preparing for Mr. Olympia." You know what
yes.
Mr. Olympia is?
That's like male competition for,
Yeah, bodybuilding,
yeah.
male and female. By the way, there is females. Okay, but for sure, females are competing with females, and
Mm,
males are competing with males. And then he give you the larger cue when you say, oh, recreational drug. What you mean by recreational? Because we need to know that recreational drugs doesn't mean street drugs. Okay,
okay.
so recreational drugs mean that you are using the drug in non-medical indication for leisure. Okay, so if you are using supplements, okay, for non-medical reason, just to gain growth of your muscle, this is called the recreational use of the medicine. Okay,
Mm,
that doesn't mean that it's not a drug of addiction. Doesn't mean that you are using it only for addictive purposes or to make your mood high. Okay, recreational drug is including both addictive and non-addictive substance.
mm,
So recreational drug, when you say it, so anabolic steroid is one of them, and this was what the case was about.
mm,
And he told you, I'm taking, he was not hiding. He said, I'm taking you the decadrabolene. Decadrabolene is one of the testosterone derivative. Okay, it's injectable. And then when the patient tell you, or any patient tell you he's taking some drug, okay, from where you are getting it, or how much you are taking it, and I already told you my coach is preparing me for the Mr. Olympia. They are taking these kind of injection in massive amounts. So I
Mm.
think one course, and they in 1 week they could take 50 to 100 injection. Okay, and
Mm.
all of that will play with his hormone, and that will
Hormones.
cause his mood changes. So what is the lesson from that is an anxiety per se can have secondary, so it can be an inherited genetic, an inherited mental health issue, chemicals
Mm.
related, or but also can be secondary presentation to either hormonal disturbance, either organic disease. So you need to exclude that, and one of them also the thyroid, as you said. So and I think the main issue that you missed the cue in the case.
Okay.
Yeah, what's your thoughts?
Yeah.
So if now you know what is the um you know you know now the key principle of the case. So what would what you would do different in the matter of
Um.
your questioning? Your questioning, I don't have any problem with it, other than that it seems to be like, yeah, you have a tick list for your mental health cases, and you are going through it. So sleeping, eating, drinking, that's fine. But then when the case started to be modified little bit, then your structure will not be helpful. So yeah, it's good that you would have a structure, but at the same time, your structure not to be rigid to accommodate, any modification in the cases. Uh, so now after you know what is the trick, what you would add more to ask?
So questions would be to ask how long he has been on the steroid
Yeah,
and how often does he use it.
yeah. And that will lead you to other question. You need to see what is the effect. So the effect of the steroid was on here, was in his an anxiety level, but does there is any other side effect of the steroid, because that's important. Okay,
Mm.
so already you know that you have gynecomastia, which one of the side effect of the steroid. Okay, and the acne is one of the side. So all of this possible presentation of such case. Okay, so it might appear for you in the real life, either with gynecomastia, either with acne, either with an anxiety. What else these cases can appear?
Um,
What else the high level of testosterone can make as a side effects?
we've mentioned the
Loss
negative.
of libido.
Yeah, that
Mm,
loss of libido, yeah, and
yeah,
decrease
it could
erection,
make him
yeah.
weight gain.
Weight gain usually it will be well, the people, so the BMI in these cases is not reflective of their weight,
Mm.
because their BMI will be high, but most probably all will be muscle wise. Okay, and this is one of the drawback of the BMI. Okay, that it doesn't differentiate between the mass. Is it the mass is muscle mass or fat mass or water mass? So in these cases, don't depend on BMI. To be honest, you
Mm.
need to see the patient. So
Okay.
yeah, BMI should be high because this is his aim. He's telling you, I'm gaining
Yeah.
muscles. He want to gain
Mm.
muscles.
Mm.
Okay. So what else?
His blood pressure could be raised.
Yeah, that is the problem, the cardiovascular risk. So blood pressure, dyslipidemia. So all of that need to be added in the blood. That's why I'm trying to, to discuss it with
Diabetes
Yeah.
you.
as well.
Sorry?
Diabetes and
Yeah, diabetes.
Yeah.
Yeah,
Raised blood sugar
diabetes.
as well.
renal insufficiency, but they need to have a symptoms for that.
Yeah, well, you are right, but the problem that the renal insufficiency will be secondary either to the high blood pressure or the secondary drug, because usually the course will not be only testosterone. So for to gain muscle mass, yeah, you will need hormonal bit of it, and it's multiple hormone usually. They will not use one hormone. I will tell you the details of that because it's important. You might see some patient like that in the practice, because gym and bodybuilding are now becoming a fashion, and source even for income. So you might see some patient in real practice. Um, the problem is with the renal insufficiency can because they are usually taking with it amino acids with overdoses. Okay, either branched chain amino acids or creatinine tablets, okay, or powders. So the overload of the protein can cause for sure renal damage without doubt. But what else can the testosterone cause? Because the side effect of testosterone is important for you to know. So what usually happens to the male when they become, when they become males? They will lose their hair, isn't it? Yeah.
I lost.
So
Okay.
yeah, hair loss. Yeah. So hair loss. What else?
Could there be thinning of the skin?
Uh, well, the skin changes, well, can be because the testosterone. The problem with the high androgen, high testosterone can preferably convert it to estrogen. So you're right thing of the skin and feminization. That's why they got the gynecomastia. But also, what is can happen to the patient, the male patient when they are becoming old due to prolonged exposure to testosterone? Prostate cancer, isn't it? One of the main
Okay.
side effects of high testosterone prostate cancer, and that's why this patient will be young. You will tell him now, I need to do PSI. I want to examine your prostate. Okay, and it's completely valid. Okay, because he might develop prostate cancer. What else?
You get liver dysfunction.
Liver cancer. Yeah, liver
Yeah.
dysfunction and liver cancer. Yeah, because all the testosterone are, so testosterone and androgen-based hormone are basically based, having a cholesterol molecules, and then it's modified through the liver to have the testosterone. So all the metabolism of the testosterone and androgen are liver dependent. So any synthetic testosterone inside the body will harm the liver. And prolonged exposure after 10 to 15 years, you would get a liver cancer. So all of this should be, in question, in a screening. You need to ask all of this, okay? You
Okay.
just, and when you bring him to examine, you need to examine all of that. The other
Okay.
thing, ask him if he's taking other drugs, because usually they will take fat burners, okay, either ephedrine, okay, either silubutol. Silubutol is beta 2 agonist, okay, and also is very common drug for fat burning. And the other thing, thyroid hormone. Okay, they would take thyroid hormone, okay, to burn. So even if you did thyroid, here will most probably will be suppressed. So the TSH will be low, and the free T4 will be most probably high, because and free T3 will be high because of the exogenous levothyroxine. What else you might find in such case? What else they would take with the testosterone? They will take insulin, and this is very dangerous. Okay, so they can, because insulin is anabolic hormone, so they will take low doses of insulin, and they might die from that, and this is the problem. They might die having, a hypoglycemic coma. Yeah, although they are eating a lot, so they will eat 6 or 7 meals a day. Okay, and they will get hypoglycemia because they are taking a lot of insulin. Okay. Um, the issue is with these cases, you need to understand how what is their perception of their own body. Okay, because that can lead you to another bit of it, that they can have what is called muscle dysmorphic or body dysmorphic diseases. Okay, which is part of it, anorexia nervosa, bulimia. Yeah, it's part of it. The eating disorder is part of it. Okay, but then patient can present without eating disorder, but he have body dysmorphia. Okay, the people that having excessive plastic surgery, they might have body dysmorphia. The people that are keen to build muscle, excessive muscle, they might be having, body dysmorphia. So you will ask him, what is the, are you, do you like having muscles, okay, or why you are gymming exactly? Why you want to go to Mr. Olympia? Do you want to be famous, or what exactly. If you dig further with this patient, he will tell you that when he was when he was young, he was very fatty. Okay, he
Mm.
was overweight, and then he was, they was pulling him in the school, and then when he become, adult, he insisted to lose weight and to build muscles. So that's his traumatizing event in when he was young, and that making him to perceive his body as, in different way,
Mm.
and he insisting to build the muscle. So this was the complexity of the case. Okay,
Mm.
and then added complexity that we add that you have a gunshot. So what you will need to do for the gunshot, because this is the important bit,
So with the
because
gunshot,
it would put you on medical legal problems if you didn't do something about it. So, okay, so what you think you need to do?
um, so I need to confirm if he's got any self-harm or suicidal risk.
No, even if there is no self-harm or suicidal risk, you are in the process of diagnosing him having generalized anxiety or an anxiety disorder. Okay,
Mm.
although it's body dysmorphic disorder from my
Mm.
point of view.
Okay.
Okay. However, body dysmorphic disorder, part of it that they get are having an anxiety. So an anxiety, and he's snappy, and he's already telling you, oh, I'm feeling that
Mm.
I might become physical, isn't it?
Physical.
So all of this and alarming,
You
yeah.
need to tell the police
Yeah, he
about
need to
it.
inform the police. Okay, and if he refused to inform the police, you need to disclose that to the police. Otherwise, you will be in a trouble.
Mm.
Okay, and explain to him, well, disclosing to the police what is happening doesn't mean that they will take your license. It's just they will reevaluate the situation, and then they will let us know what is their decision for your safety and for
Mm.
the other safety. And you tell him, I'm so sorry if, if you are not, if you are not planning to tell them, I'm unfortunately, by law, I will need to disclose that to them. I'm just letting you know before doing that. And this is critical, please don't forget because that can put you in a massive medical legal responsibility in real life.
Mm.
Okay, whenever and you will encounter a lot of people having gunshots, especially if you are working in the district, in district surgeries, or you are working in surgeries in village. So all the farmers, they have gunshots to protect their lands from, the animals. So it's not uncommon. So that you will find it in real life.
Mm.
Okay. Yeah, I know it's a difficult situation to everyone coming with mental health and having gunshot to start to talk with him about that. But again, this is the law, you need to follow it. Okay.
Okay. Thank you.
The other thing, when you are doing the full blood count, you need to look at very important thing, because it will make you either referring him urgently or non-urgently, or to keep him in the community. What you want to see in the full blood count. Have a think. Mm. What your
Um,
thoughts?
in case if there's infection, white cells.
Well, why I said might be high because it's type of steroid, isn't it? Anabolic on all of them from cholesterol and anabolic steroid. So steroid, one of the side effects of steroid can increase the white blood cells and the
Mm.
neutrophil. But no, not this is that it will not make a big difference in your
What
management.
raised platelets?
This is could be, but the most important for more than the platelet, because if the platelet is
Polycythemia.
exactly
Oh.
polycythemia, yeah. Polycythemia, if you find it more than zero point 0.6, then this indication of referral to the hematology. Yeah,
Okay.
yeah,
Yeah.
complicated, isn't it?
Mm.
It is, but it's important to know it. I don't think that it might, appear with that much of complexity, but it's something that can be modified a little bit to be more simpler. I just try to put multiple angle in it and put them in a case. Okay, so being having dysmorphic, muscle dysmorphia is one complexity, and then
Mm.
in the management, trying to convince them that you would, he needs to stop the medication because that can affect his heart, and then and trying to convince him, to build his muscle in the natural way. This will take a lot of effort from you. It's not an easy. And then the other complexity is in knowing what is the blood that needed to be and what you need to do, and then the PR examination, the prostate, all of this are complexities. It's multi-complex system issue. And then these people will need from you also refer to the community mental health team if if he truly have a muscle dysmorphia, because he need to have a CPT. Okay, so
Yeah.
we'll tell him, will send you to the community mental health team. They will give you cognitive behavior therapy. It's a way that will make you, perceiving your body shape in different way. I feel that the relation between you and how you are perceiving your body shape is not unhealthy relation, or not on a healthy view. We need just to teach you, or to learn you how to, to accept yourself and your body, and to look yourself in different way. Okay, so that's important. Okay, to refer him to for CBT, or and then also to the mental health team.
Yeah.
Okay, not an urgent basis. Okay, but that you need to consider it. You might also refer him to the sport medicine. Yeah, because the issue is the main drawback when they stop the steroid, so the muscle bulk will suddenly decrease. Okay, and that will affect his mental health, dramatically. So you might consider telling him, or I would refer to the, to the sport medicine specialist, which can, help you to decrease the loss of your muscle. So usually they will give him more endurance muscle exercises and cardiovascular exercises just to try to keep their shape.
Okay.
Yeah, yeah.
Yeah.
Yeah. So I hope that was an eye opener for such case.
Yes, it is.
Yeah, I will just open the PowerPoint. Should be somewhere here. I'm not sure. Yeah, so just rapidly recap it. Did anyone of you are seeing the PowerPoint, isn't it?
Yes, I could
Yeah.
see.
Yes.
So do you know who is that?
Yes, Rami.
Yeah, so Big Rami is the big Egyptian Rami. Yeah. So he's one of the Mr. Olympia champion for 2 years, I think. Yeah, 2 years. So he's Egyptian. Okay. So since he's Egyptian, I need to put his picture, isn't it?
Mhm.
Okay, and he's one of the biggest, biggest arm, I think, or neck. So he's a good man, I think. Yeah, but I think to reach that level, it's very difficult to be natural. Okay, with my due respect, but it's impossible to be natural. Okay? So please try to read about body dysmorphic disorder. Okay, because it's something important, and you might, encounter with it in the exam. And it's not difficult. All of them will be the same management. Cognitive behavior therapy, mental health, and the drawback on on the physical health. So it's multi-complex, three angle of complexity that you need to act on it. So I think it could be a potential question in your exam. This is just explanation. What is the drawback of excessive exercising, either physical or even, that sometimes they are using diuretics for dehydration before the context. Okay, and that so they can present even with electrolyte disturbance. Okay, and then or excessive exercises, and then excessive exercises can have a drawback in the female part. We can have drawback in the menses, so should presentation can be amenorrhea, or even they might be rarely presented with bone disease, isn't it? Can be present with osteoporosis or osteomalacia. So that's also the other possible presentation of such cases. Um, so these are example of anabolic steroid, but what I want from these two is any one of you, doctor, know what is stanozol, where we are using it, stanozol? We're using it in very important disease. Other than,
Bre-
you know, so yeah, go ahead, doctor.
Yeah. So the thing is, this is the stanozol.
Mhm.
You're talking the aromatase inhibitors.
Yeah,
So, so it is. There are two things. One is obviously they're used in the treatment for infertility. So, like
yeah,
letrozole,
yeah,
it belongs to
exactly.
that group. And
Yeah,
so it is basically it helps. Like being myself from gynae background,
yeah,
so letrozole it helps in the monofollicular development. It gives
yes,
good endometrial tissue for implantation. And the second thing is they have a role in breast cancers.
exactly. But there is one third thing. We are
Mm-hmm.
using it in emergency.
Stanozol in emergency.
Yeah, can you imagine? Any
Oh,
thoughts? Hereditary angioedema. Okay, so
oh,
hereditary angioedema, we're using it for prevention mainly. Okay, so we are starting it for sure in the acute stage when the patient, you know, appear. Okay, we give concentrated C1 and, you know, concentrate C1. Yeah, C1. I forget what is the name. C1 thing, yeah, but we're usually ordering it from London. Okay, because it's not available, and then we'll give it IV, but stationary. But until we have the C1 concentrate, we need to give stanozol because it's decreased, it's anti-bradykinin. So hereditary angioedema is different than the usual angioedema. So the usual angioedema, which is either allergic angioedema or drug-induced angioedema, is histamine mediated, but hereditary angioedema is bradykinin mediated. That's why in the hereditary angioedema, patient will not respond to antihistamine, will not respond to steroid, and will not respond even to adrenaline. The only thing is the antibradykinin, which is either stenazole, either the C1 concentrate. Uh, so you might find some people that, you know, it's very rare, right? To be honest, the hereditary angioedema, but you might find some people in your practice that's on it for that cause. So it's worth knowing the indication. Uh, um, and then they are saying that this was on new information for me that between the athletes, there's, you know, the anabolic steroid is called juice. Okay, you know, you might be the actor will tell you I'm taking juice, so you at least you know what juice is. Okay. These are the side effect of the anabolic steroid. We said most of it, I believe. Maybe testicular atrophy, we didn't mention it. So when you bring him to do the PR examination, you need to have a look at his testicles as well to and to make sure that he doesn't have any testicular tumor, because testicular tumor can be a hyperandrogenic ones. So this one of the things that you need to consider in your differential. Okay. The other s- tablet that can be used with beside the steroid is the you know, ephedrine and the beta 2 agonist fat burner. HCG, I didn't see, to be honest, anyone using it, but it's written that can help stimulate the testicular function. Diuretics, as I told you before, the competition usually they are using diuretic to decrease their weight. Okay, and for definition of the muscles, so it will be three-dimensional shape of the muscle, depend on that. And also calcium, they are taking a lot of calcium, even IV calcium. So it will help the muscle contraction on the stage. So all of that, you need to at least have, knowledge about it. Growth hormone, and the problem with the growth hormone is the facial deformity. So the A face or the large lower jaw of the bodybuilders. If you will have a look at all the most of the bodybuilder currently, you will have their lower jaw is very big, and that's one of the side effects of the growth hormone. And the other thing, a big tummy, and because because they will make hepatomegaly and splenomegaly as well because of the growth hormone, and it's very carcinogenic, the growth hormone. Tamoxifen is not used as as body build, bulking agent is used to to counteract the side effect of the of the testosterone. So as Johan said, it's anti-androgen, so it will decrease the side effect of having gynecomastia. So and also the sides, the flanks, usually the testosterone will make you having bulky flank, and fatty flank. So tamoxifen will decrease that side effect because it will decrease the conversion of testosterone to estrogen, and also will decrease the estrogen effect on the receptors. Insulin, we said already that they can have hypoglycemia and the thyroxine to increase the fat burning. And this is how you can approach the case. So in the history, you need to ask about other substance, mode of delivery, make sure that also if he's using injectables, not to mix it with other people. So there is a risk of having hepatitis C and AIDS. And in the mental health, ask about eating disorder, how he's perceiving his body, and then the anxiety and domestic violence. In such a case, if he told you that he might be, physical, okay, against his partner, and there's a children in the house, then that can alarm you about safeguarding issue. Okay, this is another added complexity. And then examination BMI, I'm against, to be honest, that because BMI will not reflect the true fat of this patient. Most of them will have high BMI in the very obese, category, and actually all of their body is muscle. So BMI is not an accurate estimate here of their true weight. And then the skin, as you said, can become more thin, acne, and striae. And I think we already discussed most of that, which is the liver function, testosterone, which here is important because here if they have impotence or they have problem with the testosterone level, usually this is reversible, but it will take some times up till 2 years. Okay, so even if you find that testosterone is low, that's not indication to refer him to andrology. You need to wait and then tell him that that will take some time to be reversed. We need, to stop the Medicaid, the steroid, and then after that we'll have every 6 months we'll have testosterone level and also sperm count, and then after 2 years, if still the testosterone is low, then you can refer him for fertility clinic. Full blood count, as we said, for the hematocrit, and then the cut off to refer the patient in the male side is 0.6, and then the female side is 0.56. Okay, and CKD, liver function, lipid and hemoglobin A1C, to assess the cardiovascular risk. Yeah, and I think that's all. The management, I already explained it in the 4 or 5 points. Okay, so I'll not go through it from here. And you might consider doing ECG, and this will be the next case. We'll discuss the ECG of that patient perhaps. The other bit, this is a summary of the all the side effects, visual summary. I find it very helpful rather than all of this written information. I like to study from photos. So and then the Metropolis Police, which is part of the UK police system. Okay, this guidance is very good. If you have time to read it, I advise you to read it. But the summary of it, that if you have patient in this list, so if the patient having depression and anxiety, psychotic, or maniac episode, okay, personality disorder, neurological disorder like Parkinson's or Huntington's disease, epilepsy even, or you feel that he's alcoholic or drug abuser and have a firearm license, you need to inform the police. Okay, so if the patient is refusing to inform, you need to inform the police. Please, please, please be aware about this list. Okay, it's important, not only for exam and also for your real life. Okay, if you didn't inform, you will be medical legally chased for that. So please protect yourself and the community for sure, and your patient. Okay, because you don't want the patient to be harmed for something that you can prevent it. Okay, and a lot of stories where we heard you can see patients that have mental health issues, especially in the state, because I think having firearm in the state is much easier than in the UK. Then someone will take the firearm and go to the school or go here or there and just shoot the people. So being aware about this regulation, I think, is important. Okay, so this is the first case. I am happy to receive any questions, doctor. If you have any question, I will just stop the recording.